Hi, welcome to iReports on CNN.com. I'm Kirsten Kloss. Thank you very much for watching. Well, in today's program, we're going to talk about an age-old problem, and that is the fear of dentists. It's been around as long as I've been alive, and I'm sure it's been going on for years before, but things have changed, and I've asked a special guest, Dr. Nowak, to join us on the program today. She's a 1997 graduate from the University of Saskatchewan. Dr. Nowak has 17 years of dental experience and operates a private practice delivering comprehensive dental treatment for thousands of patients in her city of Calgary, Canada. Well, Dr. Nowak, thank you very much for joining us on the program today. It's great having you as a guest.
Well, thanks for having me.
So maybe you could tell our audience, first of all, what percentage of patients that you see in your practice that actually have a fear of dentists?
Majority of patients that come to my practice are in their late 20s to late 70s. And I have to say I encounter some type of anxiety quite often among that age group. So I would definitely say it's prevalent among adults.
And what is the root cause of this fear? And what's most likely the kinds of things that they're afraid of?
Well, from what I've noticed is that past unfavorable childhood experiences at what affects or has the most impact on adult people anticipating that experience to repeat itself for them. Other group of people would often have negative dental experiences in their adult life, and they project that experience to repeat itself. There are a group of people also that are very anxious by nature, and being surrounded by medical and dental professionals, it's already frightening to them. And most things that people feel uncomfortable with coming to the dental office is the sight of needle, the smell of the dental office, the noises, anticipation of pain or complications from dental treatment. But some people are actually quite apprehensive, and even sitting in a dental chair can be frightening to them.
It's interesting because I have children, and they're in their teens now, and there's no fear of the dentist at all among my kids. Obviously, that's attributable to changes that have occurred in the industry. So maybe you can elaborate a bit on what modern technologies and advancements have come out to basically alleviate this pain and stress.
I think dentistry has significantly changed, even in the last decade. And thanks to science developments, the new doors will open in dentistry, and new technologies are available, new materials that can make dental treatment less invasive, more comfortable for the patients, and more predictable. But also what I've noticed change is approach to patients' care. And what I found works really well for patients in my practice is inviting patients for initial visit. That may lead to a new patient exam or just a conversation, and during that time we focus on getting to know the patients and understand them, and act as their advocate, so they're more comfortable throughout their dental treatment, even coming to the dental office and knowing that they have an ally in a doctor. It makes the whole experience much more comfortable for them. So that's, I think, very aspect that's changed a lot now. For those people that are quite fearful, first of all, we try to determine what level of anxiety they have, and based on that, offer them options they can utilize to make their dental care more comfortable. And that really varies from simple things like noise eliminating headphones, listening to their favorite music while they have the dental treatment done, or listening to the audiobooks. We offer warm blankets, warm compresses. We have chairs with delicate massages that seem to be tolerated really well for most of the patients in helping them alleviate mild level of anxiety. And for those more anxious patients, we have nitrous gas, laughing gas, different levels of oral sedation. During the procedure, patient is conscious but asleep and not really aware that much of or caring that much what's happening around them. So that's a very good option for more anxious patients too. And knowing that and having the advantage of choosing those options makes people much more comfortable during the dental treatment than prior.
Well, it's amazing because I do remember the anxiety from my childhood, and going to the dentist nowadays is a lot easier. And so obviously there's some advice that maybe you can give our audience on how to bridge the gap and feel more comfortable going to the dentist and looking after a very essential medical need. Maybe you can share that advice with our audience.
I think the important point to keep in mind is if health is important to you and you want your teeth and gums to be healthy, be proactive. So having regular dental exams or care done rather than waiting for the symptoms to appear, it can make your experience much more comfortable, the dental treatment more predictable and less invasive. And I know when we're doing exams here, we're focusing on predicting the risk factors for the patient. And that enables us oftentimes to see the potential of the disease in the future, or even preventing the disease from manifesting itself, so that the treatment we provide is much more conservative and the prognosis is much better, and the dental care itself is much more comfortable for the patients.
So yeah, so basically proactive and early diagnosis. It's well, we hear it all the time. Look after yourself and lead a happier and healthier life. Well, Dr. Nowak, thank you very much for joining us on the program today. It was great having you as a guest. Explaining to us all of these new developments and helping people with such a cerebral concern that they have when dealing with dentists. Thank you very much for joining us.
It was my pleasure. Thank you.
Our guest today, Dr. Nowak. You can visit their website if you want more information about Dr. Nowak and her practice at drnowak.ca. Thank you all for watching. This is iReports on CNN.com. Bye for now.